Chances are you or someone you know has shoulder pain. Is it you? Maybe somebody you know? Either way, by watching this video, you'll be able to help yourself or someone that you may know. To get us started today, we have Dr. Earl with us. How are you?
Doing great, thanks.
Good, good. Today's topic was going to be meniscus and cartilage within shoulder pain, which kind of rolls me into the next question. What types of injuries with the meniscus and the cartilage would those be within the shoulder?
Well, the interesting thing, so as doctors, medical providers throw out meniscus, they throw out what's called a labrum tear, they throw out cartilage tear, they throw out all those words to describe what's going on. What you need to realize is that they are the same thing. So the labrum is a cup-like structure made up of cartilage that then has the humerus, the ball of the humerus that allows it to slide around inside of that shoulder. The shoulder is the joint of our body that has the most motion. It really can move almost 180 degrees in almost every plane. So it really has an amazing amount of motion. Well, because of that, there's a lot of structures associated with keeping that motion stable. One of those very important structures is the meniscus or the cartilage that resides within the shoulder. So again, cartilage, meniscus, or labrum are all exactly the same thing. And its purpose is to provide a little cushion, if you will, and provide a little bit of encapsulation structure for that humerus to move around in.
Well, yikes, that sounds like if that's an injury you have, that'd be quite the problem. What would kind of make it a little bit more excessive with that kind of injury?
Well, there's a lot of different types of injuries that can occur at the cartilage level. So one of the most common that we hear about is a tear. So again, they'll say labrum tear, meniscus tear, cartilage tear. Same thing, involving the same structure. And then you can also have a tear at different locations, anterior, superior, inferior, posterior, different locations within that cartilage structure, within the meniscus structure. And so because of that, we have patients that say, well, anytime I do this motion, it causes pain, or anytime I do this motion, it causes pain. So very specific motions can put pressure on that tear and cause pain. And that's why patients say, well, it doesn't hurt everywhere all the time. Well, that's because a tear is in a very specific location. So tears are common. The other thing that's common is wear down of the meniscus and cartilage. So over time, it can actually wear away. The reason that happens, and this is proven in the pathology books, that it's because of poor oxygen and nutrient delivery to help it repair and regenerate. And then the third issue can be arthritis, and arthritis can build up inside of that meniscus and around it and really cause a significant amount of pain and discomfort. The really interesting thing is the reality is our bodies are amazing. The instruction manual that put us all together, our DNA and other components, it's still in you, it just needs to be activated. And getting that healing activated again is what Renew-O2 and PRP-O2 really does. A recent study by Duke University actually proved that yes, we as human beings can regenerate that cartilage. And then a second really large study, the Nobel Peace Prize in Medicine and Physiology for 2019, actually showed and was given to a team that revealed that oxygen activates 300 healing and rejuvenation genes inside of your DNA. It's a big deal.
Wow. Well, it sounds like a lot of moving parts for a very specific injury. With that being said, what would be our options for care?
So again, options for care, we hear a lot about surgery, but in my opinion, again, this is me, and after 16 years of emergency medicine, I got to see a lot of the complications that happen. And there are a lot of complications that can happen with surgery. So I think surgery needs to be one of those last options that you consider. People will talk about cortisone injections. Cortisone is a very powerful anti-inflammatory, and it does have some side effects. There's an 8% bone loss with each injection, and it's actually been shown to stretch out and relax out those ligaments, leading to further problems. And so what you really want to look for is something that builds the tissue. That's where we get into things like stem cell, Renew-O2 or PRP-O2, or just straight PRP. Well, stem cell is going to be amazing, but it's not quite there yet. Stem cell has about a 50% success rate. That's a flip of the coin. And it doesn't seem to obtain the amount of healing that we really want for long term. And so you're looking at something that will activate the healing process, and that's what we do at Denali with the Renew O2 or the PRP-O2.
I see there. And how does it compare to some of those other alternatives that you were speaking about with either stem cell or surgery? What kind of puts it over the top?
Well, again, stem cell is very expensive and it's just not quite there yet. We can't control what those stem cells become. In addition, only 2% of the stem cells actually live after they're reconstituted, is the way that we talk about it. So they're flash frozen, they're taken to a very cold state, but only 2% come back alive. That's a very low number. As far as surgery is concerned, again, if that's necessary, we'll recommend that. But the reality is very few patients actually require surgery. The body's amazing and it does a wonderful job of healing if we give it the tools that it needs. But surgery has, in many cases, about a 10-year shelf life, meaning that they're hoping they get 10 years out of it. And if you have side effects, well, they can be sometimes quite significant, and they're very limiting, and they're very hard to get over. The body heals that with scar tissue. Scar tissue is very fibrous and very difficult to get over.
Makes sense. So with that being said, obviously having different options in regards to care, who would know whether or not they qualify for the services that Denali could provide?
Yeah, I think the big thing to know if you qualify and or don't qualify, I mean, this isn't for everyone, is one, you need to be willing to heal. You need to be ready to get better. The reality is we're going to turn on your body's natural ability to heal and get after it. That's pretty amazing. You have to understand that healing is a process. It's not an event. A lot of patients, because surgery is this defined event, think that, okay, I had my surgery and things are going to be better, but wow, you've got a long recovery time with that. And there's downtime and other complications with that. But again, there are some patients that the damage is so significant that surgery is the option. So I think as you start to look at, qualifying or not qualifying for either the Renew O2 or PRP-O2, get a really good diagnostician. Really find out what's going on. Sometimes that requires imaging. Sometimes it does not. A lot of times we can figure out what's going on without really detailed imaging, being that X-ray, CAT scan, MRI, or what have you, because we can tell what the anatomy is telling us. So get diagnosed, make sure you know what's going on, look at your options, and then if you're thinking you want to regenerate the tissues, consider Denali.
Alrighty, and to get more information from Denali Medical, where would we be going to? The
best place is denalimed.com, DENALIMED.com, and the phone number, if you'd like to give us a call, is on the website. Feel free to come in and give us an opportunity to provide a consult as well.
I mean, I'm ready to heal. I don't know about you guys, but again, that was denalimed.com, and we thank Dr. Earl for being with us today, and we will see you next time.
Thank you.